And get started then with that. Share my screen here. All right. So rapamycin. So what exactly is rapamycin? So rapamycin is a medication that we've used in clinical medicine for some time, and it's basically known as an immunosuppressant. We use it classically in transplant patients because it seems to reduce T cell activation and proliferation, right? And so if you have transplanted another organ, you want to suppress the recipient's immune system so that their immune system won't attack the donor organ, right? And um, oftentimes we'll see this drug used in kidney transplants, right? Now, what's interesting about this drug is, in addition to its immunosuppressant effects, it seems to suppress proliferation of many other cells, and it does so by acting on a special type of protein kinase. Maybe you guys have heard about this, the mammalian target of rapamycin, mTOR. And this is a really complicated protein that's involved in a lot of different cellular processes. But what's interesting in terms of the anti-aging realm is that mTOR is really important in the conversion of quiescence to senescence. So I'm going to take a step back because some of these terms might be a little bit unusual. But what is quiescence and senescence? So if you guys remember from, I guess, high school biology, if you remember like the cell cycle where you had like mitosis and you had where that was the process of a cell splitting up, right? You have the G0 phase where cells basically fully formed, but not really undergoing much growth. And goes to G1 where you do get some actin growth, and then the S phase, where you get DNA replication, G2, or further cell growth, and of course the M phase with mitosis, where the cell actually splits. And then it has a decision tree to either go into quiescence, right, where it just stays stagnant for a while and fully operational, or just repeat the cell cycle again and replicate, right? Now, there is another pathway called senescence, right? And what senescence is that's a pathway where a patient that or a cell that's quiescent, that's fully functional and working, moves into cellular growth without replication, which is bad because this is actually one of the mechanisms we feel is behind aging. When that process, and we call this process geroconversion. Gero, referring to the elderly, conversion, changing a cell from a quiescent state, which is healthy and functional, to senescent, where it's not so functional. And senescent cells that have DNA damage, as you can see here, they have accumulation of something called lipofuscin, which is a pigment that seems to proliferate in lysosomes, decreasing their activity, um, cell cycle arrest, um, lots of oxidative stress within the mitochondria. And so this is not something we want. And so by virtue of this, by virtue of rapamycin inhibiting mTOR, you get decreased geroconversion. So decreased conversion of a quiescent cell, a normal cell that's just not replicating, to a senescent cell, an elderly cell, right? And so that's again, the science is much more complicated than that, but that's like a very basic overview of what it does, right? So, and again, the main aspect of what mTOR really controls is protein translation, uh, the, autophagy, where basically the cell can, you know, um, incorporate other aspects of other cells. And by inhibiting mTOR, specifically one portion of mTOR, mTORC, this seems to lead to extended lifespan, delay in aging, and this is what seems to be blocked with certain types of dosing of rapamycin. Now, rapamycin does have certain side effects, and we'll talk about those in a little bit, and that seems to be with prolonged dosing at higher concentrations, and that's usually due to is inhibition of the other type of mTOR, mTORC2. We'll talk about those side effects in just a little bit. So again, just to recap, it's a medication, right? It is used clinically as an immunosuppressant at higher doses, but what's interesting is at lower doses and dosed more infrequently, it seems to slow GERO conversion, right? And that's why it's so exciting. So is there actually evidence, or is this all theoretical, that this actually works? Well, there is. So there have been multiple studies that have looked at how it reduces tumor size and extends lifespans for individuals. For example, this study looked at how it reduced the frequency of growth, or the potential growth in transplanted tumors in mice here. And it seems to decrease growth against leukemias that were in these particular mice. This particular article right here looks at how it extends the lifespan of fruit flies, right? It's kind of interesting. And this article right here looked at how it seemed to decrease cognitive deficits that paralleled some of the deficits you'd see in Alzheimer's disease in children. I'm sorry, in mice, right? And so there is some suggestion that, you know, when you apply these animal studies to humans, this could be very, very interesting. And then currently we use it. It's approved, of course, for use in renal transplants and a complicated sounding syndrome called lymphangioliomyomatosis, which is basically proliferation of the smooth muscle in the lungs abnormally, and it can cause cysts and bleeding within your lungs. And so it of course works quite well for those reasons. Okay. As I mentioned, at higher doses, we have to be worried about mTORC2 inhibition, because that seems to cause a lot of the side effects associated with rapamycin. So for anti-aging purposes, it seems that once weekly dosing of 3 to 6 milligrams is appropriate, and you want to go on for 3 months, off for about a month. And in terms of the side effects, well, at high doses, and again, this is unfortunately what some of the renal transplant patients have to encounter, immunosuppression, obviously, because it blocks T cell proliferation, so they're more predisposed to getting viruses and bacterial infections, swelling in their peripheries, just edema, lots of GI side effects. They tend to have issues in terms of platelet formation. Also, there's an increased risk of skin carcinomas. Basal cell carcinoma is pretty common. As I mentioned, because due to immunosuppression, infection is pretty common. HSV is a concern, as well as apparently sepsis. And then finally, it seems to adversely affect their lipid panel, hyperlipidemia and hypertriglyceridemia. And remember, the dose that we typically do for renal transplant patients is 2 to 5 milligrams daily, right? Now, at anti-aging doses, 3 to 6 milligrams once weekly for 3 months, and then 1 month off, the effects are pretty minimal. The main concern that we've seen, particularly my colleagues that utilize this pretty frequently, is mucositis, and that is basically like ulcerations in your mouth, and that's mainly because the cells within your oral mucosa tend to divide pretty quickly, and adding in rapamycin can lead to some cellular breakdown, but generally it's self-limited, and so if you take a week or 2 off rapamycin, it goes away. And to be honest, most of the time that they noticed side effects like that were with higher doses. They had a few patients who, one of my colleagues actually treated a patient with, I think it was 12 milligrams once weekly, and that's when that particular patient had mucositis. But at 3 to 6 milligrams once weekly, the side effect profile is very, very low.
So here's a question for you, Dr. Ryan. Do you think it's going to be part of that trial kit, that trial group? Because we had epitalin, Dehexa, and, MOTS, right? And, and
Well,
we
so
were considering
that's a good question. I think
dihexamine.
the main issue is going to be availability. So I, I'll have to talk to the pharmacy, JD. I remember when I spoke to the pharmacy that we work with, there was a concern about availability for rapamycin.
Right, right.
And so it really just depend if it's if we can distribute it through them. Um, as you can understand, since it's used a lot for transplant patients, it's sometimes hard to uh, script off label. And so,
Source it. Okay.
yeah,
Okay.
exactly.
Yeah. So I guess we'll kind of be on touch with that. But I think if I heard this correctly, Dr. Ryan, we have to like
Yeah,
microdose it, right? And
yeah.
if we were to work with it, and well, all the studies are very confirmatory. There are kind of challenges with it, right? So we have to
So,
be super careful.
and Kevin actually asked about any studies utilizing the doses that at 3 to 6 milligrams. Well, so there was actually, let's see, let's pull this up right here. There were a few studies that have looked at its dosing with individuals. It's used for, let me see, I remember seeing that study here. I can probably, Kevin, I can probably email it
You
to
can
you
post a link
specifically.
in
Yeah.
it. But what was
Um,
the takeaway, Dr. Ryan? Because you were
the takeaway
appreciate
was
that.
they looked at about 60 elderly patients that were treated with rapamycin, and they
Okay.
used differing doses, escalating doses, 3, 6, and I think 12 milligrams. And the only patient that suffered an issue was an individual that was in the 12 milligram group.
So it's
So
super safe. Like if you microdose it 3 to 6 mg once a week. Once a week.
yeah.
Okay. Okay. Okay.
And then Eric actually has a good question. What would it do with patients who have type 2 diabetes? So there is a concern that rapamycin can be linked to insulin resistance, but the it's kind of controversial. The thought process on it is it's much like um, it's the effects that you get with insulin resistance are acute, and they tend to go away over time from what the colleagues I worked with mentioned. And also, if you have treated someone with metformin, it seems to radically reduce the uh, the symptoms of insulin resistance if you treat them concurrently with metformin and rapamycin. Now, again, most patients that currently have type 2 diabetes, I probably would not recommend being on rapamycin. So my colleagues that have utilized rapamycin have used it in individuals that don't have diabetes or may have pre-diabetes, so like a hemoglobin A1C of like 5.7 or below. But generally, when they've incorporated low-dose metformin with the rapamycin regimen, that has not been a concern. But Kevin, I can probably, what I'll do is I'll post the link for that study indicating that